Ford has just went into session and will not be able to join us right now at the beginning. Maybe you can come in a little bit later. And then we'll have exciting overview of the outreach data maps that have come from the Chicago Department of Public Health via Chicago Fire Department and other groups. We had a meeting about this on last Friday. Some of you were on this, but I think it's valuable to have any newcomers know what's happening and what the capabilities are moving forward. It's very exciting. And then Vaughna will give a brief update on the fentanyl work group. We've made a lot of progress in really surfacing a lot of concerns and issues, and but we're moving forward. We're going to be meeting next week, Wednesday from 10 to 11. And then Sue Pickett's going to give us an update on the overdose prevention site, community engagement project, the phase 2 report. And please, if you have member updates, please feel free to share later in the meeting. Let us know maybe through the chat, but we'll have hand raisers at that point. And then the next meeting will be another Wednesday, November 17th. So before we go any further, I want to share a picture here that I want you to see. This was on Saturday over at Cragen Park. It was a community resource event, and here's Gail Richardson, one of our outreach workers, one of our lead outreach workers, retraining the mayor on how to use Narcan to save a life. Awesome. I say retraining because back in August of 2019, she was trained by Julie Skokna from Thresholds. I don't know if Julie's on today, but that was a big day, not only for the mayor, but for the task force, for Lou and I, because that's when we first met the folks from Thresholds and began the relationship that's led to this amazing outreach effort that's been going on. Just to give you a quick update, and Lou and team, you can jump in. They gave out 65 boxes of Narcan yesterday when they did a street outreach piece. People are coming for them, and as you see from Livia's report, we're making a difference. We're making a dent. So that's my overview right now. Right. So let's move right into the next piece and have Livia give us her presentation.
Hi everyone.
Welcome.
Good afternoon. Thank you for having me. I am going to share my screen so you can see what I've got here. Okay, hopefully everyone can see this.
Yes, we can.
Excellent. So I'm going to apologize if you saw some of this on Friday, because it is a bit of an overview of what we talked about on Friday. As Lee said, my name is Livia Verklin. I am a GIS analyst at the Chicago Department of Public Health. And so before I jump into what we're doing for outreach mapping, I thought I would just take a minute to kind of go over very briefly what is GIS, because I realize also my computer's having a little bit of a lag in PowerPoint, so I'm going to apologize for that. But I realize that I run around and tell everyone that I'm a GIS analyst, and maybe not everyone knows exactly what that means. And so GIS stands for Geographic Information Systems. And basically what that is all of these different things working together as a system to help us collect, analyze, edit, and particularly visualize and store different types of data, especially data that has a spatial component to it. So a point on the planet that we can look at. And the big thing that GIS is known for is maps. And so the way that we take this data and make it into maps is you take the real world, which is depicted on the left, and you have like the trees and the water and the buildings, roads, all of those things. And GIS breaks it down into data slices, which we call layers. And so you can have a layer for imagery, for transportation, for addresses, and so on and so forth. And when you make a map, you're basically taking all of these different layers and you're mixing them together and kind of seeing what you see. And that's the beauty of GIS and the beauty of mapping. And so it really is, let's see if we can go to the next slide, the science of where. That's kind of what GIS is kind of trying to be known as. And we're trying to answer the question, what is where and why here? And I want to point out that GIS, when you hear, oh, GIS analyst, you're probably like, what is that? You've probably used GIS and you didn't realize it, because if you've ever used GPS on your phone to get somewhere, you're using GIS. If you've ever looked on, let's say, Apple Maps or Google Maps or another GPS and looked for Dunkin' Donuts drive-through and then navigated to that drive-through, you actually queried in a GIS and then used it. So you did GIS analysis. And so GIS and mapping can show us trends over time, percent change, for example, spatial correlations such as hot and cold spots, which are on the map to the right, which we're going to talk about in a second. And then connections between different layers, which is kind of what I referenced earlier, when you put all the layers together and mix them up and see what you see. So for example, are more opioid related overdose responses occurring in parks or in train stations? That's something that we can find out. And so the map to the right is opioid related overdose EMS responses from January to August 2021. And this is a heat map. It's similar to the map that we're going to look at in a minute. They are displaying each EMS response has a specific point location on this map or in the city of Chicago. And what this is doing is taking all of those different point locations and thinking or running analysis to see the density of those points in a specific area. And then the denser it is, the more yellow or the darker red it is displayed, and the less dense that it is, it's more of a blue. So the areas that are light blue, or maybe even the areas that don't have what looks like any color on them, they're just gray, they can still have EMS responses there. It's just not dense, because you're looking for like hot spots, areas where things are happening more than in other areas. Okay, so now that everyone's a GIS expert, I'm going to transition over to talking specifically about the West Side mapping project. And so basically the way that this developed was community groups have been asking for hyperlocal mapping to help with outreach efforts. And so CDPH started this process before I was hired. I was hired in mid-June. And so some of the data collection started before I got here. And then shortly after I started, we had a meeting at Legler Library with probably a lot of you in attendance, and heard a lot of feedback and asks from the organizations. Things like number of EMS Narcan administrations per response, time, when are EMS runs happening? What are the trends over time? Hotspot locations, things like that. And so we tried to put as much of that as we could into the data sheets that we're handing back to all of you. At this time, we are not able to include some of the following: hospital transports and location of transport, individuals who have received Narcan or been transported more than once, and types of substances involved in overdoses. Those were things that we heard we were asked for repeatedly, and unfortunately, either due to privacy or due to access to data, we can't supply that information right now. So currently, what we're doing is CDPH is creating and sending out 6 map and data sheets to the groups monthly for the West Side. It's one West Side overview map containing information for all 5 community areas, and then 5 community area specific map sheets. It's one for each area. I'm going to show you all of these in just a second. So we have Austin, East Garfield Park, Humboldt Park, North Lawndale, and West Garfield Park. And so this is the West Side overview data sheet. And you can see it has a lot of information on it. We have the heat map, which is similar to the one that we looked at that was citywide a few minutes ago, or a few seconds ago, probably. And you can see that again, darker the red and into yellow is denser. So more of a quote unquote hotspot. And those are areas that have like increased concentration of EMS responses. This data sheet is showing information just from August of 2021 and just in these 5 community areas. So on the right-hand side, you can see some of the breakdowns of data. The West Side has had about 40% of citywide EMS responses consistently for the past 9 months. I believe that for the whole year, the average is like 37 or 38%. We show trends on the West Side of Chicago, so month to month, and then also year to year for that month. We can push out general information on these data sheets. So calling attention to a September 27th DEA alert, September 30th IDPH alert. On a previous one, we put information about the opioid mid-year report. Trend line showing how many responses have happened each month of the year to date. So we can see that we peaked in July and decreased from July to August. And actually for August, we were below March's numbers. So things are looking good. On the bottom is a bar graph that shows day of the week and community area. So let's say you were thinking about wanting to do some outreach in Austin. You could look at this really quickly and get an idea of days of the week that are seeing higher numbers of opioid-related overdose emergency responses, such as Saturday or Sunday. So if you wanted to dive in a little bit deeper, you can look at one of the community area specific pages. I'm going to explain it a little bit more in depth on this one, and then we're going to kind of gloss over the other ones just for time's sake. So this is a Humboldt Park, August 2021 example. And again, you can see trend information on the right-hand side, month to month, year to year. The map, again, is a heat map showing areas of high intensity or more dense amount of calls. The Chicago Avenue corridor has been a consistent hotspot. I'm sure that's not surprising to any of you. I'm actually pretty sure that all of the hotspots that I showed to all of you today will not be very surprising. But we do call out hotspot intersections for each community area, and there are over time a little bit of shifts happening. Like a lot of the big ones stay the same, but sometimes they move south or north or east or west. And then something that's really valuable that we heard a lot of people ask for was like outreach providers, like where is outreach happening? When is it happening? So we collected information, and this was part of the collection that went on before I got started with CDPH. We collected information on who is going out and doing street outreach, where are they doing it, and when are they doing it? And we have points on the map to show where, so you can see it versus the hotspots. And then we also have a heat calendar or heat chart on the bottom that shows hours of the day that have higher calls, or technically how many calls are happening in every hour of the day. And you can see who's doing street outreach in that community at those times. Here is the map for Austin. Cicero Avenue corridor emerged as the primary hotspot in July and August. Previously, it was Chicago and Cicero for June. And again, I'm sure this is not very surprising to all of you. Common EMS responses times were in Austin in June and July were also between 5 and 9 p.m. So if you look at the heat calendar along the bottom, you can see that these like darker blue colors, the lighter it is, the less responses there are, and the darker the colors get, the more responses that there are. So it's kind of like along the same lines as a heat map. It's just in a calendar form. Here is West Garfield Park for August of 2021. Hotspot area is consistently the Pulaski corridor. I will say that because we saw less calls overall in August, the heat maps looked a little bit less intense than they have in previous months. Like some of them were like bright red and bright yellow, and it seems to be a little bit less intense this month, which is nice to see. And here is East Garfield Park. Primary hotspot in August shifted from Lake Street by Garfield Park in June and July to the area between Kedzie and Sacramento along Madison in August. And again, this doesn't mean that there isn't things going on in the area that's right on Lake Street by Garfield Park. It just means that for this month, there was a more concentration in the area that's yellow. And here's the map for North Lawndale. Primary hotspot has shifted from Roosevelt and Independence to areas along 16th Street. And I did want to call out that the citywide decrease from August 2020 to August 2021, just the monthly numbers, was 34%, and North Lawndale saw a 55% decrease. So that's great to see. So those were the maps that I showed everyone on the meeting on Friday, and those are the maps that we hand out or email out once a month. So the next step, something that we've heard a lot of asks for, is general health and social services mapping. Being able to see where other, not just where other outreach providers are doing things, but where is primary care, where is housing, things like that. And so we are working on mapping tools to provide that, trying to think through the best way to do that. If you are looking for something, or if you're looking for something right now that you could kind of go to and see some of the other services that the city has, you can look at mentalhealth.chicago.gov. It is a microsite that was just launched for mental health, the mental health campaign, and it does have a searchable database with, I believe, a map that would be helpful for all of you to kind of check out if you're looking for that, something like that now. We are looking to work with partners to develop a solution to assist with timely coordination of outreach activities. And we do plan on having some updates on this at the November meeting. We're thinking through how to do this best as well. And finally, if you would like more information or to be added to the email list or to have your outreach information added to the mapping, you can contact me at Livia Verkland McGinnis at cityofchicago.org. Are there any questions? I know I threw a lot of data at everyone very quickly, so thank you for your patience. But do you have any questions?
If you take your piece off the screen, maybe we can see some hand raisers. I'm not sure how that all works, but and you can always pop it back up, Livia.
Let's see.
We have nothing in the chat box currently, but I'll keep my eyes on it. But folks are welcome to raise their hand with any questions for Olivia.
I know a lot of, go ahead.
Yeah, I have a quick question. I'm wondering if the decreases, and I don't know if you know this, if the decreases are due to outreach in the availability of Narcan?
I can't say for sure yet because I've only been looking at 3 months of data. And so something that I would love to see long-term would be, because we're mapping outreach from that month versus where we were seeing EMS calls, I would love to be able to get some trend information over time and be able to answer that for all of you a little more specifically.
Keith. All right. There's another question from Tom Walsh.
Tom Walsh
Density
is
of
in the
violence.
chat.
Go ahead, Veronica. Tom Walsh asks, is the density of violence in the report you gave similar for these areas?
The density of violence. You know, that I'm not 100% certain on because I haven't looked at violence. I've actually just started looking at violence data for our violence prevention division. And so I could probably answer that for you in the next month or so, but I haven't done any heat mapping of violence yet.
And then Julie Larson asked, who is supplying you with the data? I thought you said not from hospitals.
The data is coming from the EMS call data that we're using in the heat map is supplied from the Chicago Department or Chicago Fire Department. It is opioid related overdose EMS calls. The data from outreach activities has been supplied by the organizations themselves.
We have one more in the chat that's from Michelle that asks, how can we replicate that in Lake and McHenry counties?
I could get in touch with, or if you want to have your GIS people get in touch with us, I would love to talk to them.
So Olivia and the team at CDPH, this is wonderful. As Dr. Hug had mentioned, this is going to be great. And if we continue to refine this, I think we'll all find ways to use it for ourselves, ways to give you feedback on how it can be tweaked if necessary. Definitely, I think it's key that any providers here that are doing outreach make sure that you contact Olivia so that we can add your information there and kind of see what kind of coverage we have. And I just wanted to mention to anybody that any group that's been doing outreach and being a part of this task force in general, this impetus for this came from this group. Congratulations or thank you to CDH for listening, to really taking our concerns into consideration. I'm talking about Will Needs Jasmine and Dr. Arwadi and Matthew Richards and Sarah Richardson. So really, really great. And this is a great partnership. And we had a great meeting on Friday. If you're interested in attending it and want to use these maps and help be a part of it, please contact Livia. And if you can't get Livia's, send it to me and I'll get it to her. So, any other thoughts? Oh, Tom Huggett. We have seen similar hotspots on violence from the violence interrupter groups as facilitated by CPD. They overlap for sure, especially in the Pulaski corridor.
I have a quick question. Livia, is there any possible way that we would have information about how many of those EMS responses would have completed a transport to the ED?
We do, and I believe that I put that it was like a rotating piece of information that I included on the June or July pages, but I did not include in the August, because we can say what percentage was transported or what percentage was not transported. It was higher than I thought. I want to say it was like 95 or 97% was transported. We just can't release where people were transported to.
Thanks, Olivia. You have folks asking if you can please put your information in the chat. You're an official
Yes.
task force celebrity. Thanks for being.
Well, this is again a great resource. We look forward to including this periodically in our emails. And Libby, is this now refined into your point? This is not a beta. This is something we can share with our partners. Fantastic.
It is shareable. I'm sure there'll be some developments as we iron out some of the kinks. So I'm excited to see like where the project goes and how helpful I can be for all of you. And so I will say, if you are interested, please reach out. If you're doing outreach, please let me know, because we would love to be able to include you on the maps, because the more data that we include, the better, the stronger it will be. Yeah,
you had talked about maybe having some type of form or some type of place where folks can enter that information. I know you for the Lou and his team that you're using the schedule that comes out to just pull from that, but I think it'd probably be less time consuming for you all to be able to have a dedicated site for that.
Yeah, we're going to try to develop something for that, and when we do, we'll let everyone know, and that way we can get current information from everybody.
Okay, and last question, can you turn this into a shareable PDF? Your presentation, we can get it out to folks. That was a request. Right.
I can do that.
Yeah, somebody who attended yesterday's meeting in the South Side mentioned that.
Yes, I still have to send it out to the South Side, so I apologize if you have not received it yet, but I will send it out.
Thank you.
Thank you.
Right. Well, great. And let's move along to the fentanyl work group update. Vaughn Hernandez. Hello.
Sure. Hello, everybody. So two quick updates. We are continuing to make progress with the work group, and it's been amazing working with all of the people who have been attending, because an issue will come up and somebody will just jump up and take ownership of it. So two things that are happening is, one, that we decided that we discussed that there was more information we all needed on fentanyl. And so Lee created kind of a library or depository, if you will, for this information. So as you guys come across articles on new trends or things that are happening with fentanyl, please send it to either Lee or myself, and we'll get it in that library. And if you need information for your organization or for yourself, please feel free to visit the library. Lee is going to share the link in the chat. Is that accurate, Lee?
Yep. Let me just
okay.
link to it here. I'll do
yeah,
that
so
in a
he's going to
second
share
here.
that with you so you guys can have access to it. And then the other thing that came up in our last meeting is that we were talking about the fentanyl testing and how some places are using the fentanyl test strips. They're kind of messy. Dr. Huggett kind of jumped up and said, yeah, you know, we need to get this rapid testing approved, CLIA waivered and approved by the FDA. So I'm going to let Dr. Huggett speak to what he has done so far in that area.
Yeah, thanks, Vonna. This is going to be very brief. After the meeting, because we all thought it was such an important topic, I sent an email on September 29th to Dr. Nikki Gastala at Super, Dr. Jasmine at the city, and Matt Richards at the city, asking if they could advocate on our behalf to the feds and the FDA to kind of find out how we could get some of these rapid tests approved. So I think we're still kind of waiting to hear back from that, but I hope we can get the ball moving. I know Dr. Gastala is extremely interested in this, and I think that she could be a very good advocate. The other idea that you know, Vonna and I kind of were thinking about is if anybody had a direct connection in this type of work with Congressman Davis's office on health-related type advocacy with the FDA, that might be a helpful idea. Thank you.
Thank you, Dr. Huggett. And then I know Dr. Sorrell mentioned at the last meeting that it's already kind of happening in Massachusetts. They're advocating in that direction as well. So I think we're on the right track with this to get this moving forward. And that's all I have. Does anybody have any questions, comments?
You know, I just received an email from Dr. Gastala. I'm not going to just share it. I haven't really processed it yet, but all the folks who've been on part of that on the work group probably received it.
Great.
Check your email. All right.
All right.
Well, thank you, Vonna. And the next meeting is next Wednesday, right? 10 to 11?
That's correct. Yes.
We'll get information out before the week's out. Everybody puts it
Just
on.
lastly, directing everyone's attention to that link that Lee just dropped there in the chat box. That's the library that Vonna mentions that'll have fentanyl work group updates, documents, and things that will be resourceful to everyone here on the call.
Great. Thank you. Okay, moving right along. You know, we're into the second year of the community engagement project. This is really interacting with the community, getting feedback from the community about their feelings about overdose prevention sites. This came out of a directive from an executive order from Governor Pritzker about 2 years ago. So we want to give you a progress update. And Sue, we're ready to roll.
All right. Let me just move things around so I can go ahead and start my slideshow. Move this down. Okay, here we go. All right, I'm going to go back just a couple. Okay, so as Lee mentioned, we want to give you an update on our OPS community engagement project, what we've been doing in the past year. Just want to make sure that everyone is aware of our great partners in this project, Super, the task force, and Prevention Partnership. So I know that this is no surprise to anyone in this group. Even though we saw the great decrease in EMS runs on the west side, overall in the state last year, there were 3,000 overdose deaths. It was a 33% increase in opioid overdose deaths since the prior year. Again, I don't think anyone on this call is probably surprised about that. Non-Hispanic Blacks continue to have the highest fatality rate and continue to be more than twice as likely to die from any drug overdose than non-Hispanic whites. And again, we continue to see that the highest overdose rates are on the west side of Chicago. Some of you may have seen this slide. These are from our partners at IDPH, but this shows the fatality rate by race and ethnicity across the state for 2020. And as you can see from this chart, and I will get a copy of these slides out after the meeting to Lee to distribute. You can see that in every age group, except for those between the ages of 25 and 34, non-Hispanic Blacks have the highest fatality overdose rate. So just a little review about OPSs and what they are. And part of this is because we've just been doing some focus groups. So this is on top on my mind, and share a little bit about that in a moment. Why are we looking at OPSs? There's a lot of research from Europe and from our partners in Canada, again, that OPSs, in addition to giving people a clean, safe place to use drugs, they save lives. There's never been a fatal overdose within an OPS. Part of that's due to the fact that you have staff there who are prepared with Narcan and can step in right away and stop an overdose. And in addition to just saving lives and being able to reduce an overdose, OPSs make sure that people have the supplies that they need to use cleanly and safely. They also are able to connect people to other resources that they need, including medical care, start conversations with people about drug treatment and recovery support if that's something that they're interested in. It actually improves public safety rather than increasing crime, and also reduces the risk of infectious diseases. So as we all know, not everybody thinks this is the best thing since Wonder Bread. So OPSs are very controversial, and it's important that we engage the community, because an OPS is not going to succeed unless we have the support from the community. So that is our first and primary goal. What we have been doing since March of last year is engaging community members on the West Side in discussions about an OPS, what an OPS is, and getting their thoughts, hearing their thoughts about it, and also providing opportunities for them to learn a little bit more about it and share concerns related to various topics that I'll share just in a moment. So in this past year, these are some of the activities that we've been focusing on. I'm going to really concentrate on our survey results, our focus group results, and share our information from our 2 town hall meetings. So as you may remember, in last March, actually last April, we launched a survey both in paper and online to ask community members about their thoughts about OPS, what they thought some of the benefits might be, what they thought some of their concerns and community engagement strategies. So over the past year and a half, so both in our initial work and then here in phase 2, a total of 573 community members or stakeholders have completed a survey. The majority, more than half, are male and Black. People range in age from the very young to the very old, with an average age of 49. More than half are West Side residents. And then again, we've got a nice distribution across communities, with 1/3 from Austin, 20% from West Garfield Park, and then you can see the other communities that are represented here. We also have more than 1/3 of survey respondents are people who use drugs. That's estimated because not everybody did share some information. Lou Sias and his team did a lot of distribution to people who are using drugs, so this may not be quite correct, but this is our best estimate. 69% of the people who use drugs actually live on the West Side. So again, one of the things that we first asked about in the survey was various benefits that do you think this would be a good thing for the West Side? So again, 88% said yes, I do think the OPS would be something that would be beneficial for the West Side. Some of the comments that people included in their survey was that, people are dying, this gives them a safe place. People who use drugs had comments similar to the one below about, this is something that's going to get me off the streets. There's somebody who's going to be looking out for me in case I overdose. Another comment that we've heard both in the surveys and in focus groups is, you can't recover if you're dead. So we have to do something to try to help save lives, so that when people are ready to enter recovery, they're alive to do so. We also assessed various fears and concerns, and these are listed in the full report, and I'm not going to bore you with a lot of slides and charts. They're in the full report that will talk about how you can get that and get that distributed to all of you. So again, 22% said that they had fears or concerns about having an OPS on the West Side. And what we continue to hear is concerns that crime is going to increase, that this is going to be a place where gangs will target, drug dealers will target, because they've got ready access to people who want to buy drugs. It's not going to help people stop using. It's just going to be a place where they can use. And that we're also going to see concerns from homeowners and businesses, that homeowners are going to think that their property value is going to decrease. We don't want it by schools. We don't want people in these neighborhoods or in front of businesses. So a little just kind of explaining some of these results. So just again, The majority of people who completed a survey told us that they believe an OPS would be a good thing for the West Side, but different groups have different opinions. Not everyone agrees. So what we continue to see, we saw this in our first round of analyses, and we see it again in phase 2, is that Black survey participants, particularly those who live on the West Side, were more likely than white survey participants, especially those who just work on the West Side and might live elsewhere in Chicago or the suburbs, to report fears and concerns about having an OPS on the West Side. We also see that older people compared to younger people, people who live or work in West Garfield Park compared to other neighborhoods, men versus women were more likely to report fears and concerns about having an OPS on the West Side. We also asked survey respondents to suggest strategies for how we can get information out to community members. They suggested that we focus on the following topics. So making sure that the community understands why we need an OPS, helping the community look at examples and show examples of how OPSs have helped communities that are like the West Side, and then really stressing the benefits of an OPS, how the community will really benefit from having this in the West Side. In regards to our focus groups, we have held a total of 7 focus groups. Actually, we've held 9. I'll say a little bit about that, but from between phase 1 and phase 2, we had 7. They're 90 minutes long. They're all by Zoom. They're all virtual. In our first phase, we talked with our social service providers and business leaders and faith leaders and people who use drugs. In phase 2, we did focus groups with residents. We also talked with providers who work with West Side residents who are Latinx. And then we also did a focus group with CPD officers who work on the West Side. So and what we asked everyone, we try to cover the same topics in all the groups. So asking people what they know about an OPS, whether or not they think it would be a good thing or not, benefits, fears and concerns, what we can be doing to address concerns, who we need to be reaching out to support an OPS, who we think might be opposed to an OPS, and then again, what we need to do to share information with community members on the West Side. So all of our focus group participants told us that in their opinion, the biggest benefit is that an OPS will save lives. Other benefits that came up was that it's going to connect people to services, including mental health treatment. It will give people who use drugs the opportunities to decrease their use or cease their use. It will educate the community about opioid use, substance use disorders, and harm reduction, and also provides opportunities to educate families about medication-assisted recovery and substance use treatment. So lots of concerns have come up in these focus groups. And again, same things that we saw in phase 1, a couple new things in phase 2, but again, safety and security. How are you going to keep people safe? How are you going to keep the clients and staff safe inside the facility? Who's going to be providing that security? Is CPD going to be required to be inside the facility? How is that going to work? What's going to happen in terms of increased crime around the neighborhood? Is CPD going to be targeting the OPS and not dealing with other situations that are happening in the neighborhood? Will people who use drugs actually come and use the OPS if the police are there? How are you going to make sure that they're not going to end up being arrested? So safety and security. Location, where on earth are you going to put this? In your schools. We don't want it in your residential neighborhoods. On the other hand, we do want to make sure that it's in a place that is inviting, that the physical structure is warm and welcoming, that it's not some rundown, dilapidated building that nobody's going to want to come and use. The concern about crime and drug sales, again, I mentioned this before. We've heard in the focus groups that an OPS is just going to bring more gang activity to the West Side. We've heard concerns about youth. Are you going to let teenagers come and use the OPS? And on the flip side, what kind of message is this sending to our youth? We've been trying to work really hard on prevention and encouraging our young people not to use. And now you have this place where you're saying it's okay to come in and use drugs. We are concerned that it's going to scare away businesses. It's going to increase crime. Customers aren't going to want to come to any businesses that are located in the neighborhood where the OPS is located. And then in regards to people who are Latinx, the concern about whether or not service use anonymous and whether or not IDs would be required to be shown. We also, of course, asked the focus group about community engagement strategies. They have come up with some really great ideas. Again, many of these themes we've heard across the group. So funding and sustainability has to be transparent. We talked about this in phase 1. We hear it again in phase 2. We need to know what's going to happen. Is this something that you're going to plunk down on the west side, and then as soon as the money goes away, then the OPS goes away? So tell us how you're going to sustain this. We need more information and more data on how they have helped communities that are like the west side. When you do get the OPS up and running, it has to be a part of the community. The best way to make that part of the community is to hire people who live on the west side to provide the services. We need to be educating the community about harm reduction. We need to be doing more naloxone training, but making sure that people understand that OPS is part of that continuum, including harm reduction, to help meet people where they're at. Do a pilot study so you can show the community how the OPS is working or not working, and then to make sure we're addressing the needs of people who use drugs who are Latinx. Another theme that has come up over and over in the focus groups and some of our other meetings was the importance of partnering with law enforcement, that law enforcement has to be on board in order for the OPS to be implemented and to be successful. So some of the suggestions that we have heard in the focus groups was the importance of building relationships with CPD commanders and officers who serve on the west side, including CPD leadership in any planning activities that make place, and make sure that they're involved, actively involved in developing security policies and procedures for the OPS, and then doing continual education of CPD officers, just like we do other community members. So making sure they're invited to all of our community education events. When we hopefully have a pop-up, inviting them to tour the pop-up so they have an understanding of what OPS facilities actually look like. We had 2 town hall meetings. Hopefully some of you were able to participate in these. In March, we did a watch party where we viewed a webinar, a previously recorded webinar on the role of law enforcement and OPS. It had law enforcement officers from Canada and from Europe talking about their experiences partnering with an OPS. And then we had the good fortune of having Inspector Connor King join us at the end and answer people's questions about how to best partner with law enforcement. And he continues to be available as a resource for us as we continue to work on those partnerships. Then in May, we had 3 OPS operators from Toronto talk about their experiences getting their OPSs up and running, the rules and regulations that they have for the OPSs. They shared different examples. Each of them had kind of a different format to their facilities. One was more of a, kind of a tent, a pop-up OPS versus one that's located downtown, looks like any building, another one that's part of a healthcare facility. So we were able to see different models. They also talked about their partnerships with law enforcement. They shared community engagement tips. Everybody talked about the fact that this was not something that happened overnight, that it takes a lot of work, takes a couple of years to really make sure the community is on board, and how they continue to engage the community now that they are up and running. So in terms of what we are working on next, again, we know that we need to continue to engage and listen to community members, that it just doesn't stop. We're also really focusing on people we haven't heard from yet. So that includes recovery home providers, peer recovery coaches, excuse me, and abstinence-based organizations. And those focus groups are actually happening this week. So my good friend, Vana Hernandez, who just spoke, has been helping to organize these focus groups. She recruited people for these groups. I am very, very grateful to her, and has been helping me co-lead the groups. We did our focus group with recovery home providers yesterday, and this morning talked with our peer recovery coaches. And tomorrow we'll be talking with the abstinence-based organizations. Several of you on this call today. We look forward to talking with you tomorrow. We also plan to do some key informant interviews with Westside providers to hear their thoughts about, if we were to do this, what would that look like in terms of a preferred model, partnerships, operations. So just trying to map that out a bit. Lou has been helping get surveys out to young adults on the West Side, so people ages 18 to 34, to hear their thoughts about an OPS. What do they know? Is this something that they think they and their friends might actually use? We're going to continue to really target CPD officers and first responders and getting them involved in our activities, and then continuing to work with our local expert panel and our community advisory council to think about some new opportunities for our community engagement activities and to distribute our materials. So we do have 2 reports actually on phase 2. We've got a very short executive summary. It's all of 5 pages. And we also have the longer report that's closer to 30 pages and has graphs and charts and all those good sorts of things for those of you who are interested in looking at more in-depth analyses of the data. You can get copies of those from Lee. You can also contact me and we can send you those as well. They will eventually be posted on Super's website. And I see that there's questions in the chat, and I know I haven't looked at those yet because I've been busy looking at this. So I'm going to stop sharing here. And open up for other questions or anything in the chat that you think I need to be addressing.
All right, it looks like quite a bit here. Lee wanted people to know that links to the recordings of these virtual meetings are available upon request. And I want to make sure I didn't miss anything at the very top here. Carolyn Bloom sent over a link. She apologizes that the link is too long, but the link is to a webinar next week on SCS put on by Drug Policy Alliance.
Oh,
Thank
right.
you for sharing that, Carolyn Bloom. It's right in the chat, everybody. And
Just click it and you should get to it.
Yep, exactly. Tom Walsh shared a job opening flyer. The job opening flyer is for recovery coaches at Josephine Bakita Homes in Austin. We'll explain later. Thanks for sharing. Dr. Nance said there is a big difference in policy and community between Canada and United States, and specifically Chicago.
Oh, yes. And I want to just comment on that. Vanna's laughing because this came up in our focus group. There is a huge difference between the US and Canada. What we have learned from our Canadian colleagues and what they have shared with us is one of the ways that they have, how they implemented OPSs was their Supreme Court ruled that they see drug use, OPSs, all of this as a public health issue versus a criminal justice issue. And so that has really been the impetus and how things have been happening in Canada. So we know that. And we also have heard, yes, the West Side is not Toronto. The West Side is not Vancouver. So we know that as well. There are those big differences. Unfortunately, you know, we still look across the country to see where our OPSs happening. We know there's underground OPSs. We know there are places across the country. Rhode Island just passed some legislation. California is working on legislation. Rep Ford has been working on legislation on HB 110. You know, we know that there are all those attempts and to move these forward because you can't have an OPS unless there is legislation saying that, yes, it's legal. So we know there are all kinds of obstacles to that and things that we need to keep focusing on. In the meantime, we feel that it's important to continue to talk to the community about it, because I think one of the things we don't want to see happen is somebody puts forth legislation, somebody else says, does the community want it? If the community doesn't want it, or we have no idea if the community wants it, then we're just setting up scenarios for failure.
Thank you, Sue. Dr. Jasmine, welcome, asked or said as a side note, Chicago and Toronto are sister cities. And she posted a link there. Thank you so much for doing that. You can check out the link right in the chat box. There's a question here from Dolores. Dolores is asking if there are any OPSs at this time. I'm gonna get to her exact question. It says if they have started the OPS, are there any open at this time? From Dolores.
There are no OPSs in Chicago at this time, no.
Or the United States that are sanctioned or legal.
Lastly, Dr. Nance is saying in the chat box, we need legislation in our Supreme Court to validate public health.
Yes, agreed.
Good point. I know the Supreme Court in Canada was unanimous 9-0. That it was a public health issue and not a law enforcement issue. So we'll keep working. Please, if you want more information, we do have the executive summary of this report that Sue just gave us, and the full report, as well as the links to the videos, et cetera, et cetera. So please keep in touch if you're very interested. And I just have to say the work that the outreach collaborative has been doing is really is kind of like a 2-acre or 1-acre OPS when it's happening sometimes, because folks do come up to us and say, hey, can you come over help us over here? But we'd like to have a little bit more a concentrated kind of piece. But if you haven't been out, if you haven't really been out on the street to really kind of see what's happening out there, when we send out the schedule for the task force schedule monthly, please just think about coming out. Give us a couple of days notice, so you can get a sense of what's working now without an OPS. And thank you, Sue. And thank you, Vana, and everybody who participated in the focus groups or helped get people to the focus groups or distributed surveys. And especially Lou and his outreach team for the great work they've been doing in getting the surveys for that 18 to 30 year age group. So,
And I know Frida is on. I saw Frida and John earlier, but I also want to give a shout out to Frida because she helped with phase 2 with our focus groups too. So
yes, great. Thank you.
Acknowledge her as well.
All right. So without further questions about this, we're open for any announcements from any of the participants about what's happening, what you want us to know about. Oh, here's breaking news about how far we have to go. It's a link to a Chicago Tribune article about the expanded Good Samaritan law is tested in Crystal Lake in a drug-induced homicide case. The gist of it is that the charges and the incident that the person is being charged with happened before the law went into effect, and they're not allowing it to go retroactively. And so this is the kind of thing that we're up against in a lot of ways here. So yeah, we do have a long way to go.
I think to speak on that too, working in McHenry County and seeing how proud they are of their number of drug-induced homicides, and that being a driving factor in law enforcement getting those numbers and such. But just, strengthening Good Samaritan law is super a priority. And I know that the things that we've changed on that are not going to take effect until January of 2023. So until then, we're constantly trying to educate the police departments. And thankfully, we just recently took over training all of the police in McHenry County, which is huge, being a person in recovery and being able to humanize the people that they are supposed to be helping, right? So we have a lot of work to do. It's an uphill battle for sure, but there's hope, right?
Great, thank you, Michelle. Any other announcements, updates? We included the job opening from Tom Walsh. Carolyn Bloom said, thank you to Dr. Sorrell and Sigrid Rogers for connecting me to a list of Suboxone providers. Is anybody here from COIP or from Family Guidance that want to speak to the expansion of the MAR resources, mobile resources? I guess not. We'll invite them for an official announcement next time, but there is going to be an increase in the availability of medicine-assisted recovery drugs, Suboxone and methadone through a mobile process. We've talked to Ron Velocity and others about this, and COIP. Really, that'll help with the coordination that we're looking at with the maps. We'll be able to have a great idea of when they're out there and what kind of impact that might have. So as long as we're focused on saving lives, I think, and really making sure our services are meeting the needs of the people who need them most, I think that'll be our guiding light, and that has been since we really kicked off this, or re-kicked off this task force a couple of years ago. I think we're in the right spot here. If there are no further questions or announcements, we can call it a meeting.
Lee, before we go, I would like to announce, and I just dropped in the chat box, that I will be presenting at a conference for Kane County Systems of Care this Friday, Cultural Competencies, and I will be talking about how social workers can better work with the BIPOC community.
Well, again, thank you.
Social workers or peer support, welcome, anybody
Yes.
above our team to get there. Thank you.
Yeah. Free, and CEUs for your staff. So.
Well, thanks all.
I was just going to say real quick, I'll let
Sure.
people look at the attachments I put in. But Maryville Academy has a women mothers recovery program for women 21 to 35 who could be pregnant, already have children 10 or under, where the children don't have to be moved out of the house through DCFS. It's their apartments are fully furnished. You know, you can read the brochure, but we are looking for recovery coaches. I used to be the pastor at St. Martin de Porres Church, and I was a pastor for 12 years right in the Pulaski-Jackson corridor. So I know all of us are working for a very, common purpose, and that's to try to give people the chance to restore their lives. So if you get a chance, be sure to share that news. The best recovery coaches often are people who have been there and who are strong now and want to help others. Thanks.
Thanks a lot, Tom. You're right on about that.
I'll be out there tomorrow with Lou, helping Lou out. I have some trinkets, Garfield Park Community Council. I always like the maps of where we're going to do the outreach. So I'll be out there. I think we're at St. Louis and Lake tomorrow.
Exactly.
Right.
Exactly.
So I prepared about 40 bags with some essentials, some masks, some hand sanitizers and whatnot. And I'll be out there administering those as usual. Lee.
All right. Thanks, Hawk. And by the way, thank you all to the different organizations and everybody who helped to bring more PPE into and masks and other things to the outreach process. It really helps. And we look forward to the continuing relationships. It's only going to get better with this great group. Okay, everyone, have a great afternoon, and let's keep hoping this weather stays really nice like this. So take care of yourself.
You too. Have a good one, everyone.
Thank you, everyone. Lee, I just
Have a
saved the
good day,
chat.
everyone.
Carlos, I'll drop it in the mail. I'll email you. No worries. I got you.
Thank you, Olivia.
Lee, I see the link. Thanks a lot.
Yeah, okay. Yeah, it was in there. I just pulled it out again. It was in his email.
Oh, I must have missed it. Thanks.
Yeah, sure.
Good night.
Okay, take care.
Bye, Tanya.
I'm ending it for everybody.
All righty, buddy. Thank you.
All right. Thank you, Sandra. Good to see you. Thanks.
You as well,
Thanks,
Lee.
V.
Thank
See you,
you.
Mr. Green.
Talk
All
soon.
right, everybody. See you, outreach team. Roger, Keith, and Gail, and Edgar.